I'm San Francisco Mayor London Breed, and I want to thank you for joining us today for this very important conversation about the COVID-19 vaccine. I'm joined here today by Dr. Susan Phillip, San Francisco's Acting Health Officer, and Dr. Naveena Bobba, Deputy Director of Health, to discuss in more detail San Francisco's plan to distribute vaccines as quickly as possible. Dr. Phillip and Dr. Bobba are medical experts helping to lead the city's response to COVID, and we're lucky to have them here to help answer some of the questions that I know many San Franciscans are asking. I know this is the topic on everybody's mind. We've never done anything like this before in this country, in this state, or in this city, vaccinating this many people as quickly as possible in the midst of a pandemic. It's a complicated process with many moving pieces. While some things are out of our control, like the vaccine supply and eligibility, we are in good shape in San Francisco with a plan in place to get people vaccinated quickly once we have the supply we need. To start this conversation off, I'll give just a brief overview of the current situation in San Francisco, and then we can get right into the conversation. San Francisco is moving full speed ahead on COVID-19 vaccinations. We're creating a network of vaccination locations across the city, high volume sites, partnerships with pharmacies, using existing community clinics, new community sites, and mobile vaccination teams. To do all this, we are coordinating with the city's healthcare providers who are receiving a majority of the San Francisco's vaccine doses directly from the state, such as Kaiser Permanente and UCSF Health, creating 3 high-volume vaccination sites and providing targeted efforts to make sure communities that have been hit the hardest by COVID have access to the vaccine. On Friday, we opened the first of 3 high-volume vaccination sites in San Francisco at City College on Ocean Avenue. The site is starting with the capacity of 500 doses per day, but will have the capacity to administer at least 3,000 doses per day once we have the supply and are fully ramped up. In addition to the high volume site at City College and the sites opening at the Moscone Center and the San Francisco Market in the Bayview, we're also working to bring vaccines to people in the communities most impacted by COVID through community clinics and mobile vaccination teams. This has been a collaborative effort, and we are so thankful for our partners, both the healthcare providers and the community organizations that are working with us. We have a plan and we are ready to distribute 10,000 doses at least, bare minimum, per day once we have enough supply of the vaccine. But so far, the amount of vaccines we are receiving from the state and federal government is insufficient, inconsistent, and unpredictable. To fully deliver this plan, we need more vaccines, and we will continue to do everything we can to be ready when our supply of vaccine doses increase. But for now, vaccine supply remains our biggest constraint. Since this is such a big piece of the puzzle, why don't we get started in the conversation? And let's ask the 2 incredible doctors that are joining us today who are really leading this effort. Thank you for joining us. And either one of you can answer this question. What is the current situation with vaccine supply in San Francisco? And why are vaccine supplies so limited?
Thank you, Mayor. And maybe I will start and then Dr. Bobba can fill in if there are pieces that I've missed. As you said, Mayor, the main thing is that nationwide vaccine production is limited right now. And that is the underlying issue. Vaccine getting to us in San Francisco and getting into the arms of people in San Francisco is also very, very complex. So the federal government directly allocates just a small portion of the doses that it has. And then the rest of it gets divided up and allocated by the federal government to the 50 states. Once our California share has arrived, then it gets allocated not just to our counties, to the 58 counties, but also to large healthcare organizations. And in fact, in San Francisco, 2/3 of the vaccine that's coming into the county is going straight to our healthcare partners. That's important to realize. As you mentioned, not only are we not receiving all of the allocation, but just a minority, but it's very erratic and unpredictable right now because of those supply issues. That means that we can't know from week to week how many slots we'll have available for people to get vaccinated. The state also determines what the priorities are for vaccination. Again, as you said, very important to know. And right now, the priority groups are healthcare workers, and they are people that are 65 and older. These are the people who are most likely to get COVID-19 and the people who are most likely to die if they do become infected in the case of older adults. So as an example of that, in San Francisco, people age 65 and older make up 15% of the people who get COVID-19 in our county, but they make up about 85% of the people who die. So that's why they are prioritized first. But it is that scarcity of vaccine right now that causes the biggest problems. And then there are additional logistical problems with these particular vaccines in being able to get them to people.
So, Dr. Phillip, can you tell us a little bit more about how this works? How many doses have arrived in San Francisco, and how many have been administered? And can you also explain, I think that there's some confusion around the second dose because there's a question about the timing of when the second dose should be administered and whether or not we can just administer all the first doses and just hope that we'll get a second dose enough to administer those. So can you explain the numbers and specifically explain the second dose so that we can have a clear understanding of that?
Yes, thank you. So as of today, San Francisco has received 144,000 doses. But just to put that in perspective, if we talk again about the people who are currently eligible in San Francisco, including healthcare workers and people who are 65 and older, that group in and of itself is 210,000. So if you think about 2 doses being required for these vaccines, as you said, Mayor Breed, that requires 420,000 doses. So we don't have nearly that amount. Each of these vaccines requires a 2-dose course. They have to be repeated at either 3 or 4 weeks. The difficulty is you can't mix and match these doses. We've got to really make sure it's the same dose. Of the 144,000 vaccines, we have administered 80,000 of them, so 58%. And of the remaining doses, they are almost all allocated to ensure that the people who've received their first dose are able to get full protection from the vaccine by getting the second dose. And when you account for that as well, there are 98% of the doses that have come to San Francisco are going to the people of San Francisco who need them.
So can you help understand, I think some of the questions too that people had is, what happens if you don't get it within the 3rd or 4th week? You don't get the second dose at that time. What happens? Is it just not effective any longer?
I can maybe take this one. So this has been studied across the nation, and right now at the national level, they're saying that you could get this second dose up to 6 weeks later. The state is looking at this recommendation, and they are finalizing how they want to approach it. So we are waiting for that. Right now, we are trying to hit those marks of 3 to 4 weeks afterwards. But if we get recommendations to adjust, we will definitely do so that we can get vaccine out in the most efficient manner possible.
I think that's a real interesting point that Dr. Phillip made earlier today, just that, folks are they don't completely understand why we are basically pretty much out of doses. And I think it's important, and it's complicated, but it's important to talk specifically about the path. We're not just holding on to vaccines. We are getting them out the door as soon as we have them. And we don't completely have control over all the ones that come to San Francisco, but maybe you can talk a little bit about the path that a vaccine follows from when it is assigned to San Francisco to when it is administered. And I know that you can probably only mostly speak to what happens with the Department of Public Health because we only have control over the vaccines that we receive.
Dr. Bobba, should I start, or would you like to start?
Sure. I mean, maybe I'll start with the logistical part, and then Susan, you can talk, Dr. Phillip, you can talk a little bit more about the clinical implications. But because these vaccines were processed in a very quick manner, they require a little bit more logistical effort than normal vaccines do. So for example, the Pfizer vaccine needs ultra cold freezing, which is minus 60 degrees. And that's not usual. That's not normally how we distribute vaccines. So that temperature control is extremely important for the vaccines to remain effective. And at every single stage, from when they get produced at the manufacturing and as well as transport across the country into the county, that temperature control has to be maintained. Once it's in the county and it gets put into a healthcare system or into the Department of Public Health, we have to ensure that temperature control continues until it's ready for use. So it is required for our healthcare systems as well as the department to, have ultra cold freezer storage in order to do the Pfizer vaccine and get it out in a robust manner. Moderna is a little bit better in the fact that it requires freezers, and we can use our own freezers to do that. And a lot of healthcare system has freezers. But I just want to also emphasize that these vaccines, they're fragile. So you have to be not only temperature controlled for storage, but as soon as they're ready for use, there's a lot of requirements around how that use happens. And I'll turn it over to Dr. Phillip to talk a little bit about that.
Yes, as Dr. Bobba was saying, these vaccines, these are not the freezers that you and I are used to in our homes. These are very, very specialized equipment that are in only certain medical centers, and we have some in the city as well. And what we know is that once we start the process of thawing the vaccine, that is yet another process that takes several hours to go from the freezer until it's ready to be administered to people. Then it also has a limited life within the refrigerator of several weeks. And once we take the vials, they actually contain multiple doses of vaccine. So you can get either up to 6 or 10 doses for individual people from each vial. But once you open that vial, you have 6 hours to use it, or you have to discard the rest of the vial. And the last thing that anyone wants to happen is wasted vaccine. So the logistics and the planning and the equipment for doing this is really not paralleled. So, the idea that, for flu vaccine, we're all used to being able to go to our local pharmacy or our doctor's office or to some other site and getting it very easily. That is a very different scenario than we have right now with COVID vaccine, both because of the requirements of the specific vaccine, but also because of the scarcity of vaccine. We are hoping in the future, we will get to a point, if we are continuing to live with COVID, that it'll be just like the flu vaccine, but we are not there yet. And so this is the limitations in which we are working as a city to ensure that people get vaccinated as quickly as possible.
So the city's made a decision to set up some massive sites, which require their own set of logistics. We have City College, which we opened with UCSF, the Moscone Center, and the San Francisco Produce Market in the Bayview. Those are the other two sites that will open. These sites are going to play a huge role in efficiently providing the vaccine to people who live and work in San Francisco, but it's a huge logistical undertaking to establish and operate a site like this. Tell me a little bit about how these sites will work.
Yeah, I can talk a little bit about that. This site and this planning has been going on for months now. And I really have to, say that it's been a huge collaboration between city partners, between our healthcare system, and between our community partners to really think about and plan and then operate these sites. And part of the planning of this is that we need to ensure these sites are high volume sites so that they're able to get to, as you were saying, Mayor, up to that 10,000 marker across the city. So we need the space requirements, we need the safety requirements, we need the logistical infrastructure to store all the vaccine and ensure that, we have the proper electricity, the proper weatherization. And additionally, people, after they get the vaccine, they have to wait 15 minutes afterwards to make sure they don't have a reaction. So you have to have the appropriate places for people to get monitored. So based on that, with all of our, all of this collaboration, there have been 3 sites that have been looked at and deemed really as the right places to get this up and running. And part of how this came to be is that we know the southeast sector of the city has been most hardest hit by COVID and COVID cases. And so really looking at that area is to ensure that we have vaccine available for those populations. So City College, as you mentioned, the produce market in the Bayview were some of the first sites identified. And then additionally, our Moscone site. And once those sites have been identified or were identified, we worked with our healthcare healthcare system partners to determine how is this going to work. Because as Dr. Phillips stated, we're only getting about a third of the vaccine coming into the county. So we need our healthcare system partners to be part of this collaborative to be able to administer a vaccine. For City College, for example, right now it's a drive-through site. It has 18 lanes available, and it can do, thousands of doses a day, potentially in the future. It launched with UCSF last Friday with 500 doses, because that's the amount that we have now. But as vaccine hopefully flows in at a more robust rate, we'll be able to increase the number of people that get vaccinated there. All of these sites, we're looking at both drive-through as well as walk-in to accommodate all the different ways people can get to sites and the different transportation modes that they have available to them.
And I'm also of the understanding that the City College site, basically based on the number of doses that they have left, so that the appointments are through tomorrow. Is that correct?
That is correct. They are through tomorrow. And that's, again, based on our vaccine allocation. We will hopefully get some more news about allocation in the next 24 to 48 hours, and we can start planning ahead.
So tell us about who can get vaccinated at these high volume distribution sites. I think, are they open to anyone regardless of who their insurer is?
So, Mayor, again, the limiting factor is vaccine, as Dr. Bobba and you have both said. And so for right now, it really is limited to healthcare workers and people that are 65 years of age or older. But, as you pointed out, we really want to do all the complicated work on the back end and build these systems so that it is simple for the people who live and work in San Francisco to know where they can go to get a vaccine. So yes, the goal is, and the plan is, as vaccine supply increases, that anyone will be able to access vaccine at these sites, no matter who is operating the site, whether it's our UCSF health partner or our Kaiser Permanente partner. I don't have to be a Kaiser Permanente member to go to that site. And that is the goal. We are going to be sharing resources, sharing accessibility across the city for the benefit of all of the residents and people that work in San Francisco.
Well, we know that, just for clarity, here in San Francisco, we are still in Tier 1A, and that includes people over the age of 65. It includes healthcare workers, in-home support services workers, EMTs, and we anticipate that network is about 210,000 people. So we've heard a lot of folks who have been a little bothered by the fact that San Francisco has not gotten to, teachers, bus drivers, police officers. And in fact, Marin has already gotten to teachers, and other counties have moved in a way that people believe San Francisco is not moving. Can you explain that and why, it's a lot different here in San Francisco than it is in other counties?
One important reason is that we have such a robust healthcare system. We have so many healthcare workers that are here in San Francisco serving our residents every day. That is a strength. That is part of the reason why we have one of the lowest death rates of any major city. And that means that it's going to take us longer to vaccinate all those people that have been serving us throughout this entire year of the pandemic. So that is part of the reason why we have not yet been able to move past the healthcare workers into the other tiers. That is actually a strength that we have this large healthcare workforce here. And so we acknowledge that. And we also know that with the limited vaccine supply that we're getting, we're moving through that group as best we can. With all of my health officer colleagues across the region, all of our goals in every county is to get every resident, every worker vaccinated as quickly as possible. So that is a shared goal. It's just some of us, like San Francisco, have a larger share of the healthcare workforce than some other counties do.
And I want to express my appreciation for the work that you all did early on to get vaccinations to people who are in assisted living facilities, both Laguna Honda and other places where some of the highest risk patients have been. It was a huge undertaking, and it was done very well. And although we've had our challenges, when you think about a place like Laguna Honda, with over 700 patients and all of those employees, the work that was done there with our partners, in this particular case, Walgreens, it was significant to be able to accomplish that. So let's talk about eligibility for this vaccine. How does one go about getting one?
So I can talk a little bit about that on the operational side. There's a couple different ways. If you're a healthcare worker, generally we recommend you start with your employer because a lot of them have been able to get vaccine either through through themselves or through the big healthcare systems. If you are an independent person that is not associated and have not been able through your employer to get vaccine, then it is to talk to the healthcare systems. As Dr. Phillip and remarked and has been stated earlier, the healthcare systems are now vaccinating all healthcare workers and have made the major healthcare systems are and have made this available to people outside of their network. So that is one way to access vaccine. The other way is, we are working on trying to get networks up and running, not only through the healthcare systems, but also through other partnerships like our pharmacy partnerships and our community healthcare clinics. And so again, as vaccine becomes more accessible to San Francisco, some of these other partnerships can start to also vaccinate our healthcare workers. For the over 65 population, again, this is a large population, and we're saying that those that are in the higher age ranges should be the priority because they are at a much higher risk for death. So a lot of the healthcare systems are starting with 75 and older, which is appropriate. But our goal is to try to get to as much of this population as possible, as quickly as possible. It is really dependent on vaccine amounts that we're getting allocated, and we will get to you. So I know there's a lot of, maybe frustration or anxiety around this. And I just want to say we're getting it out as fast as we can. And we definitely hear your concerns. Just given the limited supply, we are having to prioritize, but that does not mean that if you are in these priority groups that you will not get vaccine. And the goal is to try to get, this phase done, hopefully in the next 2 to 3 weeks. But it will all really depend on the allocations that we receive.
Well, Dr. Bobba, I know that some San Franciscans have questions about the safety of the vaccine. Can you tell people who are watching about the safety record on both types of the vaccine and about why they should take this vaccine when the opportunity presents itself?
Yeah, both of these vaccines have gone through, extensive trials in terms of safety records. And then now they have been studied across a major part of the population. And actually recently, there was literature released by the CDC showing of the more than 4 million doses given, that there were only about 10 anaphylaxis episodes across the entire country. So a very minor amount, and all of those were reversed immediately. So I think that's been in the media that anaphylaxis is a concern, but it's a very rare concern. And that's also why we monitor for 15 minutes afterwards. In terms of other side effects, the main side effect is probably after your second dose, you can get muscle aches, you can feel kind of fatigued, you might get a little bit of an injection site, redness or soreness. And all of that generally resolves within 24 to 48 hours. So the ability to have a 95% effective vaccine to COVID far outweighs the concerns around the vaccine. And especially in our communities that are really being devastated by this disease, where we're seeing hospitalizations and deaths, the benefits really outweigh the risk.
And so basically you are strongly recommending the 2 doses. Can you tell us why, and then tell us who's going to be keeping track of the first and second dose and how that works to ensure that those second doses are available for the person that received the first dose?
Absolutely. So yes, 2 doses are recommended, and depending on the type of vaccine that you start with, and remember, they're nearly identical in terms of super high efficacy, 95% for both of them. So whichever one that you get that's available, that's the one you should take, because doses are in short supply and we want you to get the one that's available to you. But you need the same kind for your follow-up dose. So that is either going to be at 3 weeks if you get Pfizer, or it's going to be at 4 weeks if you get Moderna. And so we are keeping and we're tracking, and there's very detailed documentation that's required. Another one of the logistical challenges that has to go to the state. But in that way, we understand who has gotten the vaccine, when they've gotten it, and when they're due for their follow-up. And that is part of the systems that are being built across the city. Health systems have ways of doing it, and we're doing that in COVID Command as well, to be able to know when to call people back and schedule them for their follow-up shot. The efficacy, that very high 95% protection, really is only shown when people get the 2 doses, either 3 or 4 weeks apart, depending on the vaccine. So after people get their first dose, they shouldn't feel like, oh, I've gotten the vaccine and I'm completely in the clear. They really do need to have that second dose. And so as we were talking about, this is part of our thinking. When we get our allocations, we want to make sure that we can, for now, schedule people at that 3 or 4 week interval. And so we're planning accordingly. We want to be able to give people that second dose. And that is also part of the logistics and the thinking through how we do this well and carefully for the people who need vaccination.
Well, one of the things that I wanted to just kind of touch upon, because, I think that there are concerns that the city should be completely responsible for this, right? Like that we should take on the responsibility, even though it's not necessarily within our control. We remember the beginning of this pandemic, we had to set up these testing sites from scratch. We didn't have enough needles. We didn't have enough PPE. There were some challenges with setting up these sites. And a lot of the testing really fell on the hands of the city and county of San Francisco. And there were challenges with the private healthcare providers who were also receiving test kits. But we were then, as a city, held responsible for administering all the testing. And in many cases, there are still people who are using the city's system to test, even though they have private healthcare insurance. It's been one of the most challenging things that we've had to face. And part of, of course, my push as mayor to, the state and the feds is to provide more supply to our public healthcare system so that we're administering more faster because of our lack of control over the private healthcare providers. Luckily, at least the private healthcare providers are working with us, even though we don't have the data completely. But, how is this system that we have set up now? How is this plan that we have set up now to administer the vaccine? How is this going to be better than what we had to deal with testing, especially with our private healthcare providers?
Yeah, I think I can start, and then Dr. Phillip, you can weigh in as well. I think one of the big things is a lot of the lessons that we learned with testing, we are utilizing them to plan for vaccine. So very similar, what do these sites have to look like? How can we get a large number of people through them? How do we meet the demand? I think one of the major differences here is that testing potentially had an open market that you could actually go potentially purchase test kits off of. That's not the same with vaccine, right? This is a very limited supply. It is being tightly controlled at the federal and state level. And so there are specific allocations coming in. So we have to work in partnership, because if we don't collaboratively work with our healthcare system, it will be a decentralized and not well-run process. And so this is actually, I will say it's we have to ensure that there's collaboration. And in some ways it's forcing collaboration, because this cannot be successful if the healthcare systems do this on their own and the city does it on its own. We have to come together to serve the residents of San Francisco based on the allocations we're getting. And so far that collaboration is, abundantly clear, with the healthcare systems really being in partnership with us at these mass vac sites. We also know that, the mass vac sites are one way of looking at how to distribute vaccine, but there also will need to be a community focus here with community sites and community hubs that can give vaccine at a much more personalized level with, community providers that know the community, that have trust with their residents to get vaccine there. So we're looking at multiple ways to get this vaccine out. And again, the healthcare systems, whether they're large healthcare systems or smaller doctors' offices, they will all be part of this and working collaboratively.
Well, the last question I want to ask, because I think one of the biggest concerns I have is a lot of the misinformation and the criticism about San Francisco and our rollout plans for the vaccine. The impression that we just started planning for this yesterday, the impression that we're not prepared, that we're not getting the vaccines out fast enough. there's a lot of information, and sadly, it's causing a lot of confusion out there, and it's really causing a lot of frustration amongst many San Franciscans. And I just want, either one of you or both of you to just talk about, the fact that we have prepared for this early on. We are getting the vaccines out as quickly as we can, and how well we're doing in San Francisco, especially in comparison to other places, even though it might seem confusing, especially because of the second dose. Tell us your perspective as the two leaders of this effort, how you believe San Francisco is doing, and how we can anticipate that we will do even better, especially once we get the supply.
Yeah, maybe I'll start, and Dr. Phillip, you can finish. So in terms of our planning, our planning started as soon as we heard that the vaccine trials were occurring, and that there were promising results. Over the summer, we started planning around this, and we dusted off, our previous work that we'd done around mass vaccination with H1N1 and some other things like hepatitis A, to start looking at those plans. And then we really used, as we kind of went into fall, our flu vaccine clinics as the model, because even though flu vaccine, the requirements around storage is different, we still had to, think about what is the impact of COVID on administering flu vaccine, what are the spacing requirements, what are the protective gear that is needed. So all of that was utilized to set up flu clinics in the community as a test run of what could work and what might not work. And so that happened all through, the fall into the winter to get flu vaccine out. And we built upon that then to think about, okay, we now know the understanding around flu vaccine. We know, our past experience with mass vaccination clinics. And as we understood how allocations were going to happen, we worked very closely with our healthcare systems to develop, these different strategies in addressing the needs of the community in terms of getting vaccines. So the mass vaccination sites, the community sites, and our pharmacy partnerships are really kind of the pillars of how we're going to get vaccine out. And all of this is going to be ongoing improvement. So as things, start to roll out, as things change, we are going to be adept and nimble to change with them. But at this point, the city really has a robust plan to get vaccine out as quickly as possible, as long as, we get more supply.
Thank you, Dr. Bobba. And Dr. Phillip, you want to add anything to that?
I agree 100% with what Dr. Bobba has said. I think that the only other pieces I really want to emphasize is that this planning has been going on for months, and it's why we are poised to be in such a good position when vaccine becomes more available. I will also say that in looking around and talking with others, I think that this approach that you alluded to, Mayor, of being able to have any door be the right door for a person in San Francisco to get vaccine is unique. It is community centered. It is individual centered. It really makes the systems work for the people instead of the other way around. And I think that this is the right way to get vaccine out to people quickly. So now we just need the vaccine. I also want to say that this is a good problem to have. There was no guarantee that we would have highly effective vaccine at all just a year after this brand new coronavirus was identified. So we are up to this challenge in San Francisco. We have built an amazing infrastructure. We have great people at the city with our healthcare partners in the community working on this, as we've heard this afternoon. And we're looking forward to getting more vaccine and really rolling up people's sleeves and getting vaccine in there.
Well, let me just thank you both for your work since the beginning of this pandemic. Thank you so much, Dr. Phillip and Dr. Bobba. You both have been incredible leaders in this effort, and we appreciate it. We appreciate all the work done by the people who are part of the Department of Public Health. I know that everyone is ready to be done with COVID. I'm so ready to be done with COVID myself. And just know that we are doing everything we can, and I have confidence and faith in the work of the Department of Public Health here in San Francisco, because they are the reason why you see San Francisco, one of the second densest cities in the country, have one of the lowest death rates in the country. It's because of their work. It's because we acted fast. We have been a leader. And so now is not the time to fall apart. More than ever, we are going to have to be patient. We know that the vaccines are here. We know that with a new president who is prioritizing COVID vaccine production, that we anticipate that more will be to come. And so it just means that we have to just be patient. We have to wait our turn, and we will get there. We got great news yesterday that we'll be reopening San Francisco with outdoor dining and a number of other salons and places of business that could not open in the past. That's good news. We're headed there. So now is not the time for us to, I think, question the decisions of the Department of Public Health or lose faith. We are going to get through this. The light is finally there. And we know there's clearly a lot to discuss on this vaccine. We can't get to it all today, but we will continue to provide regular updates to the public about the vaccine in San Francisco. And we're regularly updating information, which is available online at sf.gov/COVID vaccine. We know that we're at the mercy of the state and the federal government with regards to supply. As soon as we have information, as soon as we have supply, we'll get you that information and we will get those vaccines at the door. As a reminder, anyone who works or lives in San Francisco can sign up for a notification when they are eligible to get a vaccine at sf.gov/vaccine notify. We really appreciate the time you took to listen to Dr. Phillip and Dr. Bobba on what we're doing here in San Francisco to address the questions and the challenges around this vaccine. It's clearly complicated, but we will still get there. And I have faith and confidence in what I think is one of the most incredible Department of Public Health anywhere in the country. Our numbers speak to that. We will get through this, and we appreciate everything that you all have done to follow our healthcare orders. Looking forward to seeing you all in person fairly soon. Thank you for joining us.